Hi, I'm Roshwin, an implant dentist based in the UK, and today we are going to talk about the different options available for replacing missing teeth. Whether you lost a single tooth due to an accident, decay, or any other reason, knowing your options is crucial. So let's dive right in. Firstly, let's talk about why it's important to replace missing teeth. Missing teeth can affect your oral health, appearance, and overall well-being. They can lead to adjacent teeth shifting, bite problems, and even difficulty eating or speaking. That's why finding the right replacement option is so important. But firstly, do we truly understand the effects of tooth loss? I often hear people say, "Oh, it's a back tooth. It can't be seen, so I should be fine without it." But what starts as a single tooth removal can start a cascade of events that can lead to long-term deterioration of the architecture of your teeth and jaws. It's also easy for me as a dentist to say, "Oh, you need to have a failing tooth removed based on my clinical expertise." But sometimes patients seldom realize the effect this can have on their oral health as well as their confidence. It's true that we as dentists do not necessarily have the time in a single appointment to truly educate patients on the long-term effects of losing teeth. There are several reasons why this might happen. In some cases, we may be focused on addressing immediate pain or infection and may not have the time or resources to provide comprehensive education. Or, quite often, some patients may not be receptive to information about the effects of tooth loss, particularly if they're experiencing pain or discomfort and just want to get rid of the source of pain, which is their tooth. Additionally, any information takes time to seep in and make sense. Hence, watching videos like this one or reading up prior to your appointment is helpful to gain awareness and help with making an informed decision. If you find yourself in the unfortunate situation of needing a tooth removed or extracted, it is important to discuss the long-term effects of tooth loss in your particular situation with your dentist. This includes discussing the impacts on your oral health, such as your teeth moving, bone loss, difficulty chewing and speaking, as well as, quite importantly, as your options for replacement. But first, let's talk about the emotional or mental toll it can have on you. I think it's only once you have gone through the process of having a tooth removed can you truly relate to it. It's kind of like you don't know what you have until it's gone. So what are the common emotions that you can feel going through this process? Fear and anxiety. A lot of people have inbuilt and irrational fears that either stem from a bad experience from archaic dentistry or the social preconceptions of dentistry. These could be before, during, or even after a procedure. A lot of times it can also be anxiety from not knowing what to expect, and this is totally understandable. The second is embarrassment. Losing a tooth can lead to the feelings of embarrassment or self-consciousness, affecting one's confidence in social as well as professional settings. People tend to view missing teeth as something their grandparents suffered from, and this can lead to the feeling of getting old and wondering how they've even got to this point. Thirdly, anger and frustration. Some patients might feel frustrated about the circumstances leading to the extraction, such as poor oral care, or some might have simply suffered due to unlucky circumstances or accidents like trauma, which was out of their control. A common example I've been seeing lately is accidents relating to e-scooters leading to fractured teeth and jaws. And not to forget the tipsy night out falls. Let's say this particular person who needs a tooth taken out has braved themselves and had the tooth out. Now, what are the changes that can affect the jaws and mouth? Firstly, the site of extraction, or the area where the tooth was taken out, starts filling with new bone and gum. But there is overall shrinkage of bone and gum in the area. The longer this gap is left, the more the shrinkage is likely to occur. Over time, adjacent and opposing teeth can drift into the space, reducing the available space. Now, although this can make tooth replacement at a later date more challenging for a dentist, the main issue here is that this disrupts your bite. Let's imagine each tooth is similar to a link in a bicycle chain, and your jaws are the chain frame. Each link in the chain needs to be in the right place for the mechanism to work smoothly. Similarly, each tooth needs to be properly aligned for a healthy and stable bite. If this is disrupted, it can lead to excessive wear of other surfaces and become overall less effective in function. If the chain is misaligned or comes off the gears, the bicycle will struggle to move smoothly. Similarly, if your teeth are misaligned, it can cause an uneven or improper bite force, leading to chewing difficulties and even jaw pain. Another issue that arises from this is that the movement of teeth can lead to gaps and spaces at other points. This leads to spaces for easy food lodgement and plaque accumulation, and this then leads to further gum disease and tooth decay. Now that you know the effects of losing teeth, what are the options to replace them and prevent some or most of these adverse effects of tooth loss? The first option is a denture, which is a removable appliance, also commonly known as a dental plate or false teeth. Something that a lot of us remember our grandparents putting in a glass of water before bed. These can be partial for when there is one or few teeth missing, or complete dentures when there are no natural teeth present in a jaw. The good thing about dentures is they are relatively inexpensive and a simpler process to undertake. They are also non-invasive and an option for people who have severe medical issues or overall not the best candidates for surgical procedures. A well-made denture can often go unidentified, can easily replace the gaps and restore a patient's smile. And although not always the best for chewing, they are still often better than not having any teeth at all. Another plus is they are also easy to clean, as they can be brushed under the tap with a clean toothbrush or using denture cleaning tablets. So a great option for patients who have dexterity issues. The downsides of a denture are that there is likely to be initial discomfort and an adjustment phase to it. I've seen some people get used to them or learn to live with them within a couple of weeks, while some take months and do not use them all the time, if at all. Adjusting to speaking with dentures can take some time as well, and patients may notice changes in their speech or have difficulty pronouncing certain words initially. This is because the denture doesn't just have teeth, but also pink acrylic that covers the palate and gums and the teeth around for support and stability. Kinda like trying to speak having gum stuck to your palate. Dentures do not stimulate the jawbone like natural teeth or implants, leading to bone shrinkage or resorption. Over time, the shape of the gums and jawbone can change, causing them to become loose or less stable. This is also why dentures do get loose over time, and the movement of the dentures can cause discomfort while speaking and eating. To maintain a proper fit, dentures may require frequent adjustments or relining by a dentist or dental technician. Dentures do not provide the same chewing force or efficiency as natural teeth or implants. This can make it difficult to eat certain foods, especially hard or sticky foods. Dentures may also break or crack if dropped, and repairs can be inconvenient. We do have stronger materials and even have dentures with a metal base that takes support of your teeth as well. Known as cobalt chrome dentures, these are far superior than your regular acrylic or plastic dentures. A fixed alternative to dentures are dental bridges. As the name suggests, this involves a tooth or teeth hanging off or taking support of adjacent teeth. That is, a supporting tooth bridging a gap. These can be traditional bridges. So a traditional bridge involves trimming a single tooth on either side of a gap to support a bridge of 3 or more teeth. Or you have a bonded bridge. Here, as the name suggests, you have a tooth stuck onto the adjacent tooth with an adhesive cement. This can be done mainly in the areas of your mouth that aren't subject to strong biting forces. The main advantage with bridges is obviously the fact that they are fixed and don't need removal, hence more confidence inspiring. You can eat and speak comfortably due to this reason as well. Dental bridges was a common treatment modality before the advent of dental implants. So what are the actual downsides of having a bridge? Placing a traditional bridge often involves grinding down the healthy adjacent teeth to make space, which can compromise their overall health. If the adjacent teeth are trimmed quite a bit, this can lead to further weakening of the adjacent teeth or supporting teeth, which are then loaded with weight or bite forces from your missing teeth. This additional force can then lead to fractures or pain, which then need further treatment or even removal when they become symptomatic. Having a bridge can also make cleaning a bit more challenging since you need to clean under it. If left unclean, this can cause inflammation of the gums as well as decay under the bridge, which is likely going to cause it to break. So the third option and most commonly chosen option for replacing missing teeth in today's age is dental implants. So what are dental implants? Dental implants are artificial tooth root replacements made of titanium that are placed into the jawbone. Once this has fused to the bone, we place an artificial tooth on the top known as the dental crown, the part that can be seen. You can also have complete dentures that clip on over dental implants so they don't fall out while eating or speaking, and avoid the need for denture glue. Dental implants look, feel, and function like your natural teeth. They blend seamlessly with your other teeth, and we design them to fit into your smile. With proper care, dental implants can last a long time. They are made from durable materials that withstand the force of chewing and biting, but their success does depend on host factors as well. Unlike dental bridges, implants don't require trimming of other teeth. This way, we maintain the health of your surrounding teeth. Since implants become a part of you, they eliminate the discomfort of false teeth or removable dentures. They should look like and feel like your own teeth. So what are the possible downsides of dental implant treatment? Getting dental implant involves a small surgical procedure. Now, this is not what you would normally want to do, but with new techniques and advances in dentistry, there is much less discomfort than you might think. Dental implants can be more expensive upfront compared to other tooth replacement options. However, their longevity, the fact that it does not have to affect your other teeth, and also the long-term costs of not replacing missing teeth often makes them financially better options in the long run. The process of getting dental implants can take several months, from start to finish. But hey, Rome wasn't built in a day. Dental implants have a high success rate of 90 to 95% at 10 to 15 years. Factors such as patient health and hygiene, as well as planning and execution by us, the dentist, play a significant role in the success of the procedure. If you want to know what's suitable for you, get in touch via our website with the link in the description below, and we will be in touch with you. If you found this video helpful, give it a thumbs up and don't forget to subscribe. I'm Roshwin, and I'll see you the next time.